Hello friends, so today I'm going to talk about importance of early identification of hearing loss. So in this particular presentation, I will tell you about why it's so important to identify a kid with hearing loss as early as possible. And I will also talk about the ill effect of hearing loss on overall life of a kid. So let's see. So as we know that like hearing impairment is one of the most prevalent deficit or you can say disability among other sensory organs. And there is study by Garg, Singh and Khurana in 2005 that shows that almost 5 to 6 infants are hard of hearing out of 1,000. So that's a big number. 5 to 6 infants actually it's a big number. So now I will talk about the importance of critical age. So the first 3 years of life is actually very important. We say it as a critical period. So that's why it is important, because there is something called neuroplasticity which happens a lot in these first 3 years of life. And the first years of life is like is like important in terms of the like in the acquisition of speech and language. So so that's why. So we as an audiologist, we always try to utilize the first 3 years of life as in a best way as it can be. So that's why. So most of the time, what happens that like hearing loss is a kind of hidden impairment, or you can say hidden disability, and many times it go undetected, and which can extend even for a longer time. So in general, most of the infant who are not being identified till they attend 2 or more years of age, by then there can be a irreversible damage. So that's why I'm telling you like the importance of first 3 years life. That's why we say it as a critical period. So if as a parent, if you fail to identify a kid with hearing loss by 2 years or more than that, in that case there can be some kind of amount of damage which can be irreversible. It means like which in that case child will never become like a normal kid. So that's why that's important to use the crucial period or the critical period, like crucial time. So what's the solution of this? So there is something called universal hearing screening program, like is one of the major system to decrease the burden of deafness in Indian society. But if I talk like in a practical way, in that case, the universal hearing screening program is just like a dream it's just like a dream, especially in our country, in India, because still there are very few hospitals who have a good qualified audiologist, especially in government sector. And even if you see in cities and all, especially like in cities, small cities, or you can say towns, you may hardly find a good audiologist. So that's one thing, like shortage of audiologist is one of the issue. Other thing is that lack of awareness among people. So parents are not that much aware about the importance of hearing, or parents may not be so much aware about the risk factor which can lead to hearing loss. So in those situations, like it can be a dream for a country like India to have such kind of program. But I hope in future this the dream may come true for us, and universal hearing screen program can be can happen in India just like it happens in other developed countries like USA, Australia, and Canada, etc. So let's see. So if you think as a parent, if you think like hearing loss can only lead to uh, delay in development of speech and language, so that's not true. It with this, they can also have a ill effect or adverse effect on other conditions, other things, like it can hamper the overall literacy. It can lead to it can lead to uh, hindrance in social development. It can lead to uh, hindrance in emotional cognitive development as well. So it's not only the speech and language skills gets affected, these are the other things which also gets affected in a child with hearing loss. So untreated hearing loss, that lead to low academic achievement, and that create a lower job opportunities for kids with hearing impairment. Now let's see what can happen like in terms of psychological issues. So children with hearing loss may find difficulty in while talking to with the peer group. They may feel like anger, distress, loneliness. So this can be a psychological consequence which can be possible in a kid with hearing loss. So in a broader sense, like hearing loss, if it is untreated, can lead to can affect the social and economic outgrowth of a community and a country. So it's very important to identify as early as possible. So there are some study which has clearly shown that the children who get identified as as early as possible, like before 6 months. So those kids uh, those kids gets a better speech and language outcome than the kids who identified it, who got late identification. So there are some study which has clearly shown that if a child get identified uh, with hearing loss before 6 months of age, gets a normal speech and language development similar to their peer group compared to a kid which get identified after 6 months of age. So according to as per JCI 2019, we follow the formula like 1, 2, and 3. So 1 means like a newborn must be screened before 1 month of age. 2 means a child should have a confirmed diagnosis of hearing loss and provide a proper rehabilitation options, which can be fitting of hearing aid that should be before 2 months, and by the end of 3 months, the child should get enrolled for speech and language intervention as well as auditory verbal therapy. So JCI is 2019 have like this formula we all should follow 1, 2, and 3. So I'm repeating once again. 1 means a newborn must be screened before 1 month of age. 2, there should be a confirmed diagnosis of hearing loss by the end of 2 months, as well as the child should have a proper uh, hearing aid fitting of hearing aid by the end of 2 months, and by the end of 3 months the child should enroll the parents should enroll the child for speech and language therapy and auditory verbal therapy. So now I want to talk about like the test which we do in while doing the hearing screening. So the first uh, gold standard test for hearing screening is TEOAE, that is transient evoked autoacoustic emission. But we don't completely rely on TOE. We do one more test called BOA, that's called behavioral observation audiometry. If possible, you can do another test called HRR, that means high risk register. So don't rely on just one test. Do a couple of tests, at least 2 to 3 tests, to confirm the presence or absence of hearing loss. So if the child pass in TEOE test, we ask the parents to get discharged from the hospital. If the child failed in TEOE test, we ask the parents to go for another test called ABR, that's auditory brainstem response. uh, Many times we also say it as BERA, that's called brainstem evoked response audiometry. So if the child pass in ABR test, we ask the parent that you can get discharged from the hospital. If the child fails in BERA test, then the child should go for a hearing aid fitting program and speech and language therapy as well as auditory verbal therapy. So once again, I am repeating here, don't rely on just one test, do multiple tests and then come up with a diagnosis. Like with ABR, we also love to do another test called BOA, that's called behavioral observation audiometry. So correlate the finding of BOA and ABR, and then only you come up and while doing ABR, you should also do like tone burst ABR. Like most of the time, especially in India, audiologists just do click ABR. So especially when you are doing ABR on as a newborn hearing test program. So in that case, with click also do tone burst ABR. Or if you have the facility of ASSR, you should also do ASSR. That's called auditory steady state response. So do some multiple tests and then come to a proper diagnosis. So that's what. So in this particular presentation, I talked about the importance of early identification of hearing loss, as well as we have also a good discussion about the test we do for hearing screening program, and we also talked about the adverse or the ill effect of hearing loss on overall development of a kid. Thank you. See you in the next video with some more information. Bye bye.